Well, good morning. Our lecture today is Diagnosis and Treatment Planning for Edentulous Patient. Well, diagnosis could be defined as the act or process of deciding the nature of a disease condition by examination, or it could be defined as the determination of the nature, location, and causes of disease. Well, the factor that should be evaluated to arrive at a proper diagnosis and treatment planning for a dentulous patient could be categorized into four factors: patient mental attitude, patient systemic status, past dental history, and local oral condition. Well, regarding the mental attitude, it's according to House classification, which is the most popular one. They classify the patient into four classes. Number one is the philosophical patient, and two, the exacting patient, and three, the indifferent patient, and four, the hysterical patient. Well, regarding the philosophical patient, they had best mental attitude, and these patients are rational, sensible, calm, and composed in difficult situations. Actually, they are very cooperative patients, their motivation are high, and they appreciate the effort done by the dentist, and they feel that having the teeth replaced is a normal, acceptable process. Well, the exacting patient are those patients who are precise and accurate and at times make severe demand. They wish to ask for every step done by the dentist, but if they lack intelligence and understanding, extra hours should be spent prior to the treatment to the patient, and those patients require education and understanding for each step so that to reach to a proper and best treatment plan. Well, the indifferent patient, they have little concern of their teeth or oral health, and they do not appreciate the effort and skill of the dentist. They will give up easily if the problem are encountered with a danger. They are uncooperative patient. Such a patient will require more time for their education and instruction on the value of the use of the dentures. If you don't educate those patients very well, they will reject your dentures. Well, the hysterical patient or the nervous patient, this type is emotionally unstable, excitable, apprehensive, and hypertensive. Well, the prognosis is often poor and unfavorable, and additional professional help, psychiatric help is required prior and during the treatment in order to reach to a proper treatment plan. Well, the social information that is gathered from the patient is very important. First of all, the name. You should ask the patient about his name so that to enter in the record, and when the patient asks by his name, it brings him some confidence. Also, the name gives an idea about the patient family and community. Well, the age is very important. As you know, a young patient will adapt to a denture more easily than an old one. Some problem anticipated when regarding the age is adaptation to the new denture, coordination, bone resorption, tissue sensitivity, healing, and balanced nutrition. All these factors will be more tolerated in younger patients than older ones. Well, the gender of the patient is very important. As you know, women are seeking for aesthetic and appearance, and they look for their lips, while the males are look for function and comfort. Well, occupation and social position In general, the higher the social position, the more demanding regarding aesthetic. A lecturer or a lawyer who speak too much, he would care about speech pattern, but the musician who play music or wind instrument will care for tooth position and proper sealing and proper retention of their denture, where the systemic or medical status of the patient is very important. We have first the debilitating diseases such as diabetes mellitus, blood secrezias, tuberculosis are examples. Those patients require extra instruction on oral hygiene, eating habit, and tissue rest. Consultation of physician is very important and it is advisable. Supporting bone may be affected, so frequent recall is needed to keep the denture base adapted and the occlusion corrected. While special attention should be paid to patients with diabetic because their tissue get irritated easily, so careful to handle during impression making. And also you expect more bone resorption in diabetic patients, so periodic recall is important to see if whether a patient require relining or rebasing and also occlusal correction. Well, the cardiovascular diseases, the first a very important thing is the consultation with the patient cardiologist is indicated, as some denture procedure may be contraindicated. Short yearly appointment with a pre-medication may be required, and such patient must be controlled before any dental treatment is done. Well, joint diseases, especially the patient with osteoarthritis, they may complain of limited mouth opening, so it will complicate the impression making. Sometimes you need to make a sectional impression technique. Also, the step of jaw relation is difficult when you take a centriculation record. Repeated record is needed, and occlusion should be corrected frequently because sometimes changes in the joint may be encountered. Where the neurological disorders such as Bell's palsy and Parkinson's are examples of this neurological disorder. Well, the denture retention, maxillomandibular relation record, and supporting the musculature are some of the added problem on those patients. Those patients may face difficulty in controlling their denture because the muscles and the tongue is difficult to adapt to the dentures. Well, skin diseases, a very important disease is the pemphigus because it got oral manifestation which vary from ulcer to bully. Actually, those ulcers are very painful and the danger use is impossible in such a condition. Unless treatment is done, the constant use of danger is contraindicated. Well, oral malignancy in relation to edentulous patient, you know that some complete denture wearer may get oral cancer, and during the treatment of the oral cancer, they are exposed to radiation, and you have to wait for a period after radiation, and you look for the tissue because you know that tissue having bronze color and loss of tonicity are not a good candidate for denture support. Once the denture is constructed, the tissue should be examined frequently for a phenomena called an osteoradionecrosis, so the denture should be watched carefully, otherwise osteoradionecrosis may be occurred. Well, the menopause condition in relation to denture wear, this is a very critical condition in which the females may have glandular changes, osteoporosis, burning sensation, and psychiatric changes in the patient, and these may influence the treatment and planning and the efficiency of the complete dentures. Well, past dental history should be written carefully. You must listen carefully to the chief complaint of the patient. It should be recorded well. It gives idea about the patient psychology. You know that some patients are complaining from denture instability. Other may have defect in speech problems or aesthetic problem. So chief complaint should be recorded carefully. The expectation of the patient regarding the denture should be evaluated. You know that some patient may have realistic and the other got unrealistic expectation. What's meant by unrealistic expectation are those patients who think that their denture will be so firm and stable and retentive like their natural teeth. Well, the period of edentulousness should be evaluated because this will give information about the amount and pattern of bone resorption. The cause of tooth loss should be known, as you know that a patient who lost his teeth from caries may got less bone resorption than patient who lost their teeth from periodontitis. Also, previous denture. You should know about the patient, how many denture he's keeping. You know that patient who keep a lot of denture is difficult to satisfy and risky to deal with. Well, the local factor, in addition to the systemic, we have to look for the local factor, and this local factor could be divided into the extra and intra-oral examination. Well, the extra-oral examination, it means the head and neck region should be evaluated and examined for any pathological condition. It includes facial examination, muscle tone, lips, and TMJ. Well, as you can see, examination of the submandibular lymph node, because you know that the first sign maybe of oral cancer is often a palpable lymph node that could be palpated by your fingers. Facial examination, you should look for the outline of the patient face from the frontal view, and it could be divided into square, tapering, ovoid, square tapering, and this will help in tooth selection. As you know, there is a correlation between tooth form and face form. Those with square form, you should select a tooth with square, and those with taper, you should select a tapered tooth form, and so on. Also, you should look to the patient from the profile or from the side view, and we have three classifications in the profile. We have a glass 1, which is normal or straight profile, and the glass 2, which is the retrographic profile, in which the maxilla is in front of the mandible, and we have the glass 3, or what is called the prognathic profile, in which the mandible is in front of the maxilla. Lips should be evaluated carefully. Those patients with short lip will expose much of their teeth and much of the labial flange of the denture base. So careful setting of the teeth and good waxing and contouring of the labial flange should be done. Also, patients with thin lip will face a problem because any slight change in the labiolingual direction of the tooth will cause or will make an immediate change in the lip contour. So if you set the teeth too much labially, those with thin lip will get a lip fullness, and on the contrary, if you push your teeth too much palatally, their lips will be sing palatally and look older. Well, muscle tone should be evaluated carefully. You know that muscle tone that is too tense makes cheek and lip manipulation difficult, especially when you are going to do border molding of your impression. And in the contrary, if you have a loose muscles, the lips and cheek may be displaced easily under the impression material or impression tray, which is very annoying to the patient. Well, the TMJ should be evaluated. You should stand behind the patient and using your index fingers and palpate the TMJ area. You may feel clicking or popping or crepitus, or the patient may feel pain. Well, after the extra-oral examination, we go to the intra-oral examination. First of all, we should look for the color of the mucosa. As you know that a healthy mucosa have a pink color. Any amount of redness indicate an inflammatory changes, and you should never make an impression for an inflamed tissue. You should wait till the tissue return to its normal, healthy condition and start your impression making. Well, the condition of the mucosa should be evaluated. We have three classes: the healthy mucosa, irritated mucosa, and pathological mucosa. You know, the mucosa could be easily irritated, especially when you have an alphatic denture flange or faulty wearing habit from the patient. So there will an ulcer could be occurred at the labial vestibules or the buccal vestibules, and this is called inflammatory fibrous hyperplasia, as you see in the picture in the lower part of the screen. Also, the thickness of the mucosa should be examined carefully, and we have three classifications. Class 1, it is a uniform thickness, about 1 millimeters and firm but not tense, it should have some cushioning effect. And the class 2 is a thin mucosa that will be highly susceptible to irritation from denture pressure, and the patient will feel pain easily. And the class 3 is the thick and flappy mucosa. Stability and rotation are difficult to secure for those patients, and special impression technique is required in this situation. Well, regarding residual alveolar ridge, we have the arch form. You look for the arch. It may be square, tapering, and ovoid. The most favorable arch form is the square because it will resist rotational movement, and then the tapering, and then the ovoid. Well, the cross section of the arch is classified into square to gently rounded, this is the most favorable, and then the flat ridge and the knife edge ridge, which is unfavorable. The hard palate classified into three. The U shape is ideal for retention and stability of the denture. The V shape, the retention is compromised because the peripheral seal is easily broken, while the flat ridge has minimum stability because the resistance to the lateral and the rotary forces are minimum. Well, regarding the soft palate, the junction of the hard and soft palate is very important. As you know that we have three classifications. Class 1 soft palate, it gradually slopes from the hard palate and it will form a 10-degree angles, and this is favorable for the formation of a good peripheral posterior palatal seal, while the glass 2, the soft palate, more sharply than the glass 1 to form an angle of 45 degree, and the least favorable is the glass 3, in which the soft palate drops so sharply from the hard palate, and the angle will be approximately 70 degree, and will offer the minimum seal for your denture. Well, the tongue, you should look for the size of the tongue is very important. We have three classifications. Class 1 tongue is a normal, adequate in size, but not overfill the floor of the mouth. The class 2 tongue is slightly overfill the floor of the mouth, and the class 3 tongue is a very huge tongue which overfill the floor and cover the ridge. Impression making is very difficult, and denture stability is compromised and decreased. Where regarding the tongue position, favorable tongue position is when the tip rests at the lingual surface of the lower anterior teeth and the lateral border of the tongue. contact the lingual surface of the posterior teeth and denture base. Very unfavorable position when the tongue is protruded. The seal will be broken and the patient will face difficulty in wearing the denture. So what are you going to do in such situation? The best solution is to have an overdenture supported by an implant, and also the post-mylohyoid space, or what is called the lateral throat form, should be examined. We have three classifications for the lateral throat form. A class 1, it's a deep lateral throat form, about half an inch of space exists between the mylohyoid ridge and the floor of the mouth. This is a favorable condition for the lower denture retention and stability. A class 2, it is moderate lateral throat form, and the class 3, it is a shallow lateral throat form in which retention of the lower denture is weak. How to examine the lateral throat form? As you can see in the picture in the lower part of the screen, you just insert a dental mirror at the alveolar sulcus at the retromylohyoid area and ask the patient to move or to place his tongue to the opposite side, and you feel the mirror. If it is displaced easily, it means you have a shallow lateral throat form. But if you feel resistance and it will not displace easily, you have a favorable lateral throat form. Well, radiographical examination is very important for the patient, such as panoramic, cephalometrics, occlusal, and periapical radiography are important because they image the retained root and erupted teeth, cysts, tumors, foreign bodies, TMJ disorders, osteoporosis, and bony pathological changes are revealed very well during radiographical examination. Well, diagnostic casts have some benefit in denture treatment, and it allows many purposes. First of all, it will give you an evaluation of the anatomy and relationship in the absence of the patient. Also, you could evaluate the inter-arch distance, and also confirmation of intra-oral examination are obviously revealed in the diagnostic cast. Also, you can see the arch size, the anteroposterior relation, lateral and crossbite relation, especially posteriorly, undercut determination by using a surveyor. Also, the soft tissue diseases may be more obvious in the absence of saliva and color. Also, displacement from the pressure of an old denture may be obviously revealed in dry cast. Also, planning of pre-prosthetic surgery and education of the patient by using a diagnostic cast. Well, intraoral videography is important. A digital camera, you could use a digital camera to display a well-magnified image on the monitor. This will provide the patient, the dentist, and the patient visual information when developing the treatment plan, and the patient can see his condition carefully on the screen in front of him. Well, the treatment planning of the patient, it is the consideration of all diagnostic findings, whether systemic and local, which influence the surgical preparation of the mouth, impression making, maxillomandibular relation record, occlusion, form, and material of teeth, also denture-based material, and the instruction in the use and care of the dentures. And finally, the prognosis of the denture may be influenced by the following factor: the bearing surface anatomy of the denture mucosa, the tongue position, and the floor of mouth posture, the neuromuscular control, the denture history, and psychological classification of the patient as mentioned earlier in the lecture. And thank you.